Mr Deputy Speaker, thank you very much indeed for inviting me to speak in this second reading debate of the immigration bill. It is a bill that I wholeheartedly support in all its sections, but I particularly want to address my remarks this evening to Part 3, Chapter 2 of the bill, which deals with the impact on the National Health Service of the cost of treating foreign nationals. Last year, Mr Deputy Speaker, I had the privilege of being able to introduce a private member's bill to this place, which was entitled NHS Audit Requirements Foreign Nationals. And I'm delighted that most of the measures that were being pursued in that bill find their way in terms of the content of this government immigration bill, which we have before us. In making preparations for the introduction of my private member's bill last year, I sent out Freedom of Information Act requests to all NHS health trusts across the country, over 400 requests issued, asking what the impact of the treatment of overseas visitors was on their finances. And I received back less than a quarter of replies from trusts. And from those I did receive responses from, the information was very haphazard. Some recorded the treatment of foreign nationals in different ways, in ways that actually weren't compliant with Department of Health guidelines. And what that said was that our actual understanding of the scale of the issue is at best limited and in many parts of the country virtually unknown. Indeed, Mr Deputy Speaker, there are quite wide-ranging estimates as to the cost of the treatment of overseas visitors on the National Health Service. At the very lowest end, the figure is often quoted at some £200 million. The European Commission, interestingly, quotes the figure at £1.5 billion. And I think the government, rather modestly, through the independent study that the Department of Health have done, quote the figure at some £500 million. Of that £500 million, £388 million is identified as the treatment of foreign nationals in this country who otherwise would not be entitled to free NHS care, and those costs should be recovered. The figure for the treatment of those who specifically come to this country for NHS treatment, what is often commonly known as health tourism, ranges anywhere between 70 to £300 million. So the scale of the impact on the NHS budget, and therefore, of course, on the British taxpayer, is really quite significant. Now, Mr Deputy Speaker, I don't think anybody in this House would claim that those in need of medical help and attention should be denied that, and nobody is suggesting that. Indeed, many people come to this country to receive the innovative and first-class healthcare that our health system provides, and that is absolutely right. What isn't right, however, is that the British taxpayer should pick up the charges for the treatment of people on our National Health Service who otherwise should be paying through reciprocal arrangements with other countries or through their own medical insurance. I will indeed give one.
I thank the Honourable Gentleman for giving me. Could I ask if the Honourable Gentleman could tell the House on which evidence he's basing his figures for health tourism?
Well, they are an independent assessment which has been commissioned by the Department of Health. And as I mentioned earlier on in my submission, Mr Deputy Speaker, when I have tried to get information through Freedom of Information Act requests, the figures are quite staggering from those trusts that do hold statistics, but over three-quarters weren't able to provide that figure at all. So it suggests that the scale of the problem is actually probably larger than the Department of Health even recognised. I need to make progress. Other honourable and right honourable members need to get in. It's estimated that if we were able to recover through insurance or through reciprocal arrangements like the European Insurance Health Card Scheme, get that money back for the treatment of foreign nationals on the NHS. If we were able to recover just 3/4 of that amount, then that would be the equivalent of being able to employ an additional 4,000 doctors or 8,500 nurses in the health service. So the scale of this issue is really quite acute. Mr Deputy Speaker, this is a point of fairness. It's a point of fairness to the British taxpayer. It's a point of fairness to patients using the health service, whether they are residents in this country or people visiting this country. And it is an issue that I think is one that this House has taken all too long to properly address. And that's why, Mr Deputy Speaker, I very much support the provisions of this bill, and I look forward to its swift passage through this place.
Dominic Raab.